We are delighted to welcome back some people who had presented past initiatives. We want to do a check-in with them to find out how it's going. And we're going to start with Dr. Bill O'Connell with an initiative called Expanding Washington's Behavioral Health Workforce with Bachelor-level Behavioral Health Support Specialists. Now, Dr. Bill O'Connell is an associate professor in the University of Washington Department of Psychiatry and Behavioral Sciences and director of the Behavioral Health Support Specialist Workforce Project, and is part of the Be Well initiative led by Dr. Anna Ratzliff. A licensed mental health counselor, Dr. O'Connell brings a rich background in clinical care, community mental health leadership, and integrated primary care. He previously held faculty roles at Xavier University and Seattle University, where he also served as a founding chair of the Department of Leadership and Professional Studies. His scholarship centers on counselor education, clinical ethics, and workforce development. Thank you, Dr. Bill O'Connell. We welcome you.
Thank you so much. I want to thank Todd and Laura and Chad's Legacy Project for the invitation today. And this being my 40th year since I started as a counselor trainee at a addictions treatment center in Cincinnati, Ohio. I also want to thank the Department of Psychiatry and Behavioral Sciences and the Bomber Group for giving me this mid-career opportunity to do some workforce development. So it's terrific. This project that I'm going to describe really started as an idea here at the Mental Health Summit in 2018. Dr. Anna Ratzliff talked about how can we really help build a workforce to be able to serve the needs of the community, increase access to care, and be able to improve the delivery of psychosocial interventions. So the problems that exist are probably well known to everyone here. What I want to focus on is how we thought about some solutions to this. So the vision for this behavioral health support specialist is to think about how we could create a bachelor-level provider who could work across different settings where, and as Senator Dingra mentioned, when and where people needed it. So I think this is an opportunity to see how we might leverage bachelor programs as one solution of many to helping improve access to care. As Senator Dingra pointed out, our peer support specialists and community health workers are extremely important. And there's a career ladder that leads to master's and doctoral level providers as well. And all of this is important. This isn't the only solution, it's one solution. So the vision then is that this person can work in integrated primary care and crisis services and in community behavioral health. And we're doing this by partnering with education programs across the state. And what really excites me about this work is that we're starting to see the dots show up in the middle of the state, especially on the east side. And so what's exciting about this is that we're partnering with psychology programs. If you think about psychology, there's about 126,000 graduates nationally in psychology programs, none of whom can really practice. And then we have a similar number of social work graduates. In Washington State, our community colleges started what's called a behavioral health care program through a BAS degree. And this is another pathway. But we're really open to working with any undergraduate program that can meet the competencies that we've created to help scale this role. So I've been working closely with some of our East Side partners. We had a gathering 2 weeks ago where about 60 folks showed up who represented community behavioral health agencies, integrated care, and human services. And we're really interested in hosting practicums for the students that are on the East Side. And as an example, just to understand what's happening, is we have students working in traditional community behavioral health centers doing practicums for the BHSS. We also have a student that's way up north in a county I haven't been to yet, Penderay, who's working with a primary care physician who works closely with the Colville tribe and is in a very rural area where there is no mental or behavioral health. And so this person's able to work alongside the physician with the support of a licensed mental health counselor through telesupervision to begin working in this area. And this is really what we want to do. We want to help train people where they live and where they plan to work. That's part of what this is about. So this has required a lot of work from many people. Senator Yasmin Trudeau sponsored a bill 2 years ago that was passed. Senator Dingra and Rep. Davis also participated in deliberations of this bill and supported this bill. But it established the behavioral health support specialist in Washington State. And so the role at UW, what we're doing is we're really a catalyst for this work. We're helping to build a model curriculum for this work. We're sharing that with all Washington State colleges and universities. And there is an alternate pathway that may be developed for this as well. That will be through registered apprenticeships. So the training fund's working on some possible solutions that could come about in partnering with universities to create apprenticeship pathways for this program. And we'll also have to work with lots of practicum partners because part of developing this is that we have people who are supervised and mentored into these roles. And then the Department of Health and the Healthcare Authority are doing an outstanding job of really, especially in a very, very busy time, helping to create the policies related to this new profession in Washington State and how it's going to be billed. So it's interesting about this is I'm learning a lot about Medicaid and Medicaid billing, thinking about that we're not only using the behavioral health funding for this, but also the medical funding for this role as well. So one of the things we want to keep in mind, we held focus groups 2 years ago with community partners representing a broad array of employers and educators and policy organizations, is that we want to make sure that this workforce pays attention to health equity, not only in knowledge, but in how they behave and what they do when they're working with members of our community. So practicing inclusive language, welcoming people, being present to people, and culturally responsive to our clients and patients. It's a very important element of the training of this work. And what we see too is that there actually is quite a bit of diversity within our bachelor's programs. And you think about just the volume of bachelor's degrees, there's a greater diversity within that group. We have one student from Eastern Washington who was doing a practicum on this side of the state from EWU, who's bilingual and really wanted to work with persons who are Spanish speaking. So Consejo was really generous in helping to start a practicum for that individual. And we believe that this workforce will be very nimble in terms of the spaces that they can work. So BHSS can work really anywhere where mental or behavioral health services are provided and appropriate supervision is in place. So that creates a very nimble workforce, I think, for what we're doing. There are many challenges in starting a new profession. So I think part of what we're working on right now is balancing the development of an evidence-informed curriculum alongside many of the policy work that needs to happen for a new profession to operate. Curricular integration takes time. If anyone has worked at a college or university, you understand that if you get an idea, it's a great idea, but it can take 1 to 2 years to make changes that might impact the delivery of a curriculum within a college. And that's a good thing. It helps to provide quality and oversight to the kinds of programs that we deliver. I also think at the master's level, we deal with this already, which is a shortage of supervisors. There are some mechanisms in place that we put in to help address this. One is triadic supervision. So one supervisor working with 2 students is one way of doing that. Also, there's a broad array of supervisors that can work with the BHSS, including our associates. So associates who have supervision training, and many do, would also be eligible to supervise the BHSS as they receive supervision of supervision. So it's a great opportunity really to learn how to do supervision, not just study it in a book. I think some of the successes are that we have a lot of college partners working with us. I can also say there are a number of colleges that you did not see on the map I showed earlier that plan to do this. 2 of them happen to be colleges I've been affiliated with who identify in the Jesuit tradition. I won't name them, but you might think of who they might be in Washington State. Also, I think we have active practicum sites right now who are training behavioral health support specialists, and we expect that this year, in 2025, there'll be approximately 40 to 50 people eligible for this credential who will be applying for it and be ready to work. So I think that's a tremendous thing. One of the things that is when you're starting a new profession in the state of Washington, it can be expensive. So the new credential itself is pretty costly. Again, through generous funding from Balmer Group, UW will help offset the cost of the new credential for those persons applying for it this year. This work that we're doing is in 2 phases. So we're currently in the process of finishing up phase 1 and moving into phase 2. Many of the things I talked about in phase 1 I've mentioned already, but we also want to pay attention to the needs of our adolescent and young adult population. So I've gathered together a group of subject matter experts who are from across the state to help think about what are the competencies needed to be able to work with adolescents and young adults. And we'll be working on developing that curriculum so that it's available to our education partners in the future. And I think ahead, again, this is work that requires a lot of time and effort, especially with something new. So we hope to continue to be able to help implement this work in the coming years and advocate for policies that make sense for our workplaces and our employers and the folks who need it. And also helping to guide the profession itself. So this is an exciting, for anyone who becomes a behavioral health support specialist, they're part of thinking about who are they going to be as a profession, what's their identity going to be, what are their principles and ethics going to be, so that they can be self-sustaining and not require someone from outside of that group to be able to tell them how to be a member of their own profession. Lastly, if you represent an employer, Dr. Alex Rose, who's a T32 psychology fellow at the University of Washington, is conducting a survey. She'd be very interested in talking with you. So if you have an opportunity to obtain this QR code, you can register to participate in the survey. She's offering a $25 Tango card. I don't know what that gets you, but it's something that's inviting. I am available to talk with anyone who's interested in speaking more about this throughout the day today. I'll be here till the end of the day, so I'd be happy to do that. You can also reach me through our website, BHSS WA at uw.edu, or that's our email, I guess. But please reach out. I talk to individuals, I talk to groups, I talk to organizations. I want to talk to anybody who wants to talk more about this and how it might fit within their organizations. So again, thank you so much.
Thank you. It's wonderful to hear such progress, and apparently he wants a dinner invite. No, I'm teasing. And now we're going to hear from Todd. I'm going to invite him back up to the stage, and he's going to be presenting on the Advancing Mental Health Education as Essential Learning, a comprehensive online resource. Can't wait. You know it.
One of the first things that we took on in Chad's legacy was eliminating stigma, and I already kind of alluded to that earlier. And one thing that we recognized very early on was the lack of mental health education in schools. And we figured if we could eliminate the stigma in schools, we could cut stigma off at the knees for a generation and start working upstream that way. So we began working in the legislature after a presentation that was done originally in 2018 again. And what we set out to do was to create a graduation requirement in schools through the challenge of the fact that the stigma leads to, depending on the study that you look at, anywhere from an 8 to 11 year delay from first onset to first care. And what we saw was that when we started this, there was a 2016 study that came out that among 8th to 12th grade, 20% had suicidal ideation. We thought that was going to get better, but then COVID happened and it got worse. Where some students receive mental health education, there were also systemic inequities involved in those efforts. There was a strong interest in providing mental health supports for students, especially within youth. If you were to ask youth, what would you like most in school that you're not getting now? It was information about what's happening to us. And that was universal. And so building that capacity within schools was a real struggle, and we decided that what we were going to do, we were going to go to the legislature, and we were going to tell them that what we needed was a graduation requirement for schools for mental health education. And we went through 2 legislative sessions thinking that that was going to be a slam dunk. And we wound up having to retool because in Washington State, we don't mandate to schools what they teach. We assist schools in their efforts. So what began as a statement of purpose to create a graduation requirement went to Olympia and went through 2 sessions and nothing happened. So we retooled the ask. We said, okay, what would it take to help teachers do what they need to do? And back then, there were maybe 1, 2 programs of curricula that pertain to mental health literacy. We wanted to start with mental health literacy because in the high schools and grade 8 to grade 12, that's where the crisis moment was. We didn't want to go too far upstream. So we said, what would it like to be to have an online library of vetted curriculum available to teachers in Washington State? And that idea got some movement. And in the following session, OSPI, the Office of the Superintendent of Public Instruction, was granted $75,000 to create that library. And that was for the 2020 legislative session. I don't know how many can remember back to 2020, but during that time, there was a little flu bug going around. and it actually impacted the state budget. And all of these provisos for various things, much like what's happening today, got vetoed. So, us not wanting to wait yet another year, we learned that OSPI would have developed a partnership with the Student Mental Health Assessment Research and Training Center, or SMART Center, at the University of Washington to actually do the work for them. So we said, well, how about if we just do it instead? And so we started a partnership with the SMART Center. Do we have any Smarties in the room? Hello. 2 weeks ago, a partner, Rayanne from the SMART Center, and I did a presentation at the Northwest PBIS conference, which is a teaching conference in Portland. And we did a workshop on what we're about to unveil here today. And during a group exercise, I said, okay, we're gonna role play. I am your principal, and we're in a building leadership meeting. And it's lunchtime, and we're having a work meeting during lunch. I am a visionary principal. I also happen to be an unreasonably demanding principal. And I heard somebody in the back, oh, okay, real world stuff then, huh? And I said, what I want you to do is I want you on your phones to go ahead, and we're gonna teach mental health education in our school, because I've seen the data, I've heard about it at our principal conference meetings, and we're going to lean forward, we're gonna teach mental health education in schools. So what I want each one of you to do is I want you to get on your phones. I need 3 programs that you can find. I wanna know how much it costs. I wanna know how much class time it's gonna take. And I wanna know how you access it and what kind of training is going to be required for it. And then we'll compare notes. You have 5 minutes. And they all got on their phones, and then we went around from table to table. What did you find? Well, I found 2, but I'm not even sure this is like a curriculum. And I don't know what it costs because I didn't have time to dig into it. And oh, I forgot also, I asked them to give me some information on any data or evidence behind the program that would happen. And I got 2, but I don't really know anything about them. One cost $3,000. I think the other one's free. I'm not sure, but I didn't see anything about data. Go to another table, the answer is pretty much the same. And then there were a couple that said, well, I found this one that seems pretty good, and here's the cost. Looks like there's some data. Went around the entire room and said, the one you found is one that's easier to find now, and the ones that you didn't find are out there. So what we did with the SMART Center is we developed this library. It is an online, I didn't mean to click that. From all of this work, the years of efforts, came mentalhealthinstruction.org. It is a teacher resource created so that teachers could go online and search for a mental health literacy curriculum, much like they would be shopping for a dryer at Lowe's online. It has all the specifications. It's got all of the costs. It's got all of the learning standards that might be associated with that program. It has the data. If the data exists, it has the data, and you can actually go directly to the studies associated with that data. In 2021, we rolled it out. I call it a beta site because it was something that I did myself on Wix, and it looked like that. I created a widget with a comparison chart and stuff, And it looked like that. So once it was launched, we decided the next phase was going to be to professionally develop this website and make it look like Todd didn't do it on Wix. And then we were going to expand it out of mental health literacy programs to social media, when social media exists as far as that education goes. But SEL, which is social emotional learning, substance misuse, and suicide prevention. So we wanted to add 3 categories. So the first step was to roll out something that looked like Todd didn't do it. And this, in 2023, rolled out as a professionally developed website with all of the comparison tools that we originally envisioned. So that you've got filters and categories and any number of things to narrow down what you want to see. So right now we've got one box, mental health literacy, that is illuminated. There are 10 programs for mental health literacy. There are 3 boxes that are not illuminated. And what we've been working on now is we've been working on this expansion so that we can light these boxes up. And our goal was to have another 10 per category to add to the list. We did a presentation, like I mentioned, in Portland, and made an announcement at that presentation 2 weeks ago, and I will share that with you. If you go back to that home screen, now when you scroll just a little bit further down the page, you get to a brand new announcement. The Smart Center has come up with another 190 curricula that they are just finishing developing informational packets for. Now, this is substantive, because what this means is that once this rolls out in the next 60 days, mentalhealthinstruction.org will be the most comprehensive teacher resource for online curriculum for mental health education on the planet. And I want to thank my Smarties friends for helping us get there. We just wanted to try to get some mental health education in Seattle schools. But now this site is already recognized as the National Resource for Mental Health Literacy Programs, and it's about to be recognized as the National Resource for Mental Health Education, period. And that is part of the summit's impact. Now, it's more than just having students feel good about themselves and understanding what's happening. It's about creating a network of peers around someone who's struggling so that they can talk honestly. They can go to their parents. They can do outreach for services, and they don't have to wait 8 to 11 years for care. It's also about a couple other things that are very subtle. There's been comments about workforce. And students take science, and students take art classes, and those moments inspire students to get into programs that they might want to learn more about. There's no opportunity to get interested in psychology unless you're in AP Psych in high school. And there's no interest in becoming a psychiatrist until you get into college, because you really haven't heard much about that in high school. Mental health education, while it's way upstream, could help that interest and create a new flow for a new generation into the workforce and inspire them to do that. So I would say curriculum equals interest and inspiration. Next steps. up on the board, a big national research study to answer questions that aren't answered. And we will continue to move forward in the next 60 days. Keep an eye on us because it's about to grow much larger than we thought it would. Thank you, everybody, and enjoy the day.
When we talk about systemic change tools, and I think of our teachers who are on the front lines, so overwhelmed, to be able to have this resource is incredible. Thank you, Todd and Laura, and Chad's Legacy Project. And guess what? It's break time.